for Nashville.
And good evening. Thanks for joining us tonight. Telehealth is the way of this pandemic. Vanderbilt Medical Center alone says they're scheduling 200 times the number of virtual visits than they did before COVID-19. And as News 4's Cameron Taylor found out, they say this could reshape the industry even after the pandemic.
Before COVID-19 hit our state, Vanderbilt averaged 10 telehealth visits in a day. Now it's skyrocketed to around 2,000 in a day. And parents we spoke with say traditional doctor's appointments may be a thing of the past in some cases. Hope Blackman is new to using telehealth. Before last week, she had never used this technology.
Honestly, as a working mom, I loved it.
Since then, both of her children spoke with a doctor online. It doesn't surprise her more people are turning to that for their appointments.
As a parent who has stayed home, I didn't want to risk my child's health going downtown. And so to have this was a lifesaver.
At Vanderbilt, the overwhelming demand required planning. The hospital already had the online platform, but needed to train more doctors and nurse practitioners on how to use it.
I definitely think that the pandemic has been a game changer for telehealth.
Amber Humphrey is the director of telehealth at Vanderbilt. She says it's typically used for behavioral health, follow-ups with doctors if you need a medication refill, and pediatric visits.
Patients are comfortable with this technology and they have embraced it.
You can see it in the numbers. Since March, Humphrey says they've done 80,000 telehealth visits. For the entire year of 2019, just 10,000.
If you can use a laptop and you can do it, I mean, it was just a lot easier than I really anticipated it being.
Unless there's an emergency, Blackman plans on using telehealth for any future appointments for her kids. Cameron Taylor, News 4 Nashville.
Cameron, thank you. And just to put some of the changes into perspective here, before the virus, 150 nurses and doctors at Vanderbilt were telehealth trained. That number is now up to 700, meaning hundreds of medical professionals could continue remote services even after the virus.